Good morning. We'll go ahead and get started. I'm Pam Treese. I'm the Executive Director of Westside Economic Alliance, and I am here to welcome you to our virtual breakfast forum. I have my coffee. I hope everybody has a cup of coffee or a cup of your favorite whatever. We are anxious to see everybody. This is the COVID-19, a local look virtual breakfast forum. This actually was scheduled for March 19th, I believe, and we had scheduled Marni, Kuyl, and some others to do a presentation at the Embassy Suites on the coronavirus. And at the last minute, we had to cancel because of our situation. It was a wise move then, and look at what we've learned to date. Now we're doing this, we're doing it virtually, and I really appreciate the fact that Metro West was our sponsor back on March 19th, and they're back with us as sponsor today. So I want to thank all of you for signing on here. We're expecting about 130 participants. I want to, at this time, recognize our Westside Economic Alliance board members that are with us this morning. So Teresa has got our screen up. You can see here what board of directors are attending today. We have Frank Angelo from Angelo Planning Group. Frank is also the chair of our transportation committee. Betty Atterbury is the director emeritus. Betty was the first executive director of Westside Economic Alliance. Mayor Steve Calloway, City of Hillsborough. Nina Carlson from Northwest Natural. Gina Cole, Legacy Health, Lois Ditmars, Peter Court, Town Square, Mayor Denny Doyle from the City of Beaverton, Mimi Dukas, who is also chair of our Land Use and Housing Committee, and she is from AKS Engineering and Forestry, Norm Eder, who is with CFM Advocates, and Ed Tromke from Jordan Ramus. So thank you to our board members. They're always engaged, providing us great direction and leadership as we navigate through what we used to call normal situations and through changing situations. I'd also like to recognize the elected leaders that are with us today that aren't on our board of directors. So that slide is coming up right now. With us, we have from the Oregon State Legislature, Representative Janine Solman, again from the City of Beaverton, Mayor Denny Doyle. From the City of Forest Grove, we have Councilor Tim Rippey and Councilor Val Valfrey. From the City of Hillsborough, we have Mayor Calloway and Councilor Anthony Martin. From the City of Sherwood, we have Councilor Renee Bruce. And from the City of West Lynn, Mayor Russ Axelrod. City of Wilsonville, Mayor Tim Knapp. And from the Tualatin Valley Water District Board, we have James Doan. So thank you very much to all of our elected officials that are with us today. I know these are tough times, and I really appreciate the work that you all do in your respective jurisdictions and the work that we're doing collectively together to make sure that we navigate through this pandemic effectively. So with that, I would like to thank Legacy Health for being our breakfast series sponsor. They are a sponsor for all of the breakfast series, and I appreciate their support. And also for this particular forum, I'd like to send out a special thank you to Metro West for your sponsorship. You've been a longtime member of Westside Economic Alliance. And with that, I'd like to turn it over to Tom Belusco to talk a little bit about Metro West and what's going on with you guys right now.
Great, thank you for the introduction, I appreciate it. Definitely interesting times. This is something unprecedented in many generations, so we're dealing with it with our first responder partners as absolutely best we can. I want to start off by thanking Pam and Teresa and the Westside Economic Alliance. This is a wonderful partnership for us. We're happy to be here today. I'm interested, obviously, in the presenters today, of which we work with to some degree, and it's super important stuff, and I'm glad there's so many people on the phone today. Metro West, just briefly, second generation family-owned business. A few things that you may not know about us is you see us drive 911 vehicle service in Washington County. You may not know that we have an almost equally as large presence in Clackamas County, which we're very grateful for. Although we do not run primary 911 service in Clackamas County, we are very actively involved in ambulance and other wheelchair medical services and transportation services. You may also not know, as I sit here in our world headquarters located across the street from our good partner Intel at Ronler Acres, that we are a family of companies. Metro West has many companies throughout Oregon and Southwest Washington. There are 6 of us totally in totality, all providing in some degree emergency medical services or critical care team transportation, bariatric ambulance transportation, and something that we're very excited about, especially in these COVID times, is dealing with mobile integrated health. So actually seeing patients, whether RNs or paramedics, in people's homes to avoid transportation, to avoid hospital numbers. So I don't want to keep going on and on. I just want to be thankful and grateful to have the opportunity today. Pam, Teresa, thank you very much, and to your board. I just ask that you keep all first responders. We work very closely with our partners across the state. I know TVF&R is on the line today. We appreciate them very much and what they do. City of Forest Grove's on the line, and others. I'm going to leave too many people out. So appreciate your first responders. Thank you very much for being here, and we'll go get them today.
Thank you so much, Tom. And you absolutely hit the nail on the head that our first responders are critical to, always critical, but certainly critical during this very difficult time. So thank you again for your sponsorship, but also please extend to your family of employees and people that work with you our appreciation for the work that you do and the continued support that our community gets from Metro West. So thank you for that.
Thank you.
Absolutely. And at this time, I'd like to introduce Marni Kuyl. I've had the wonderful opportunity as commissioner in Washington County to work directly with Marni. She is an amazing professional. She has worked so hard during this pandemic, and we were just talking about the fact that the 2 of us were in Washington, D.C. in late February when we got the notice of the first coronavirus infection in Washington County and also in Clackamas County. It was on her birthday of all things. So what an amazing birthday present. But she has really come through as such a leader during this difficult time. I'm pleased to have her with us today. Marni has been with the county for several years. I don't know the exact number of years, but she comes to us from the state of Washington, but is native to Arizona, has done amazing, like I said, amazing work. She's also board chair of Health Share, which is an important collaboration that we all benefit from as well. So with that, I'd like to turn it over to Marni. Please give us your information. We can take it, and we'll be, I'm sure we're going to go through our presentations first, and then we'll have Q&A. We'll ask you to put your questions into the question box after both presentations this morning. At the conclusion of Marni's presentation, I'll be introducing Dr. Ken Williamson. So Marni, take it away.
Great, thank you so much, Pam. It's great to be here. I really appreciate this opportunity. Let's see, get this going. Okay, there we go. I think we're online, but I really appreciate the opportunity. And, you know, one of the things I want to start out by saying is that Pam was really generous in saying nice things about me, but it has been a real blessing to be in Washington County during this, because I have had so much support, not only from our elected officials, our board. I've been on at least weekly calls with the mayors, and they have been supportive. Our legislative delegation has been really supportive. And there's been times when I've been giving really bad news that people didn't want to hear, but everyone was really willing to listen to the public health science, and sometimes they push back and they ask hard questions, but they were always respectful and always really supportive of public health and myself and my staff. So in addition to that, our community has been just fabulous. We've stepped up. Our businesses, which we'll talk a little bit more about today, the healthcare system, our first response system, everybody has really pulled together to really work together and do our part to reduce the impacts of this pandemic. So I really appreciate being here in Washington County. So with that, I am going to give you some numbers today, let you know where we are, and a little bit about what we're doing for our local businesses. I was telling Pam earlier, I actually have a little bit of better news today than I've had in the past with numbers. So we'll start out with Oregon numbers, work to regional, and then go to Washington County. So as of yesterday, there were 280 new cases reported in Oregon. So that's a cumulative number of just over 12,000. And when we talk about the cumulative number, it's all of the cases since February 28th. And just as a reminder, February 28th was the very first case in Oregon, and it was in Washington County. So we've been working really fast and furious since that time. It's called a novel coronavirus, and that's because it's new. And so we have been learning just as fast during that time. So as this has gone on, we've learned more information about how the virus is transmitted, how we can prevent transmission, how to treat it, all of that sort of thing. So we did have yesterday in Oregon 3 new deaths, so a cumulative number of 237 deaths. And statewide, we are seeing rising hospital admissions. About just under 10% of people are have been hospitalized over time with this virus. So a look at the region. So we are part of Public Health Region 1. It includes Clackamas, Multnomah, and Washington County. And as you know, the governor has tied our 3 counties together in respect to when we can move to phase 2. And so this is the regional indicators that the governor's office and OHA and our 3 counties are watching closely. So the first is the trend in positive percent of tests that are positive. And the goal is that that would go downward. So as we're testing more people, we of course see more cases. So that's why we really watch percent of positive tests. And regionally, we're seeing an upward trend in this number right now. So that's, and I've indicated in red. So red is the wrong direction. So that's the trend that we don't want to be in. The other number that we look at, and this is a much improved number since last week. So percent change in cases, and that should be less than 5%. And regionally, we're at 2%. So that's a very positive trend. Just in a week's time, last week we were in more the 20% range. So a good change there. Percent of cases not linked to an existing case. So this is one of the concerning areas. It should be less than 30%. And we're trending upward in the region, and you'll see soon in Washington County as well, 54% of cases are not linked to an existing case. And what that tells us is that there's more community-wide spread. So when we interview a new case, we ask if they have been potentially exposed by other positive cases. We look at where they work, where they may have visited. We look, is there any links to current outbreaks, current workplaces, or other known positive cases. And when we don't see that, then that's an indicator that there's more widespread community transmission that's happening. So the other is trend in COVID-19 hospitalizations. This is a number that we want to obviously see go down. And right now we are seeing a slight upward trend in hospitalizations. We continue to watch daily hospital bed capacity, ICU capacity, and ventilator capacity. And that's a really important indicator, because as you remember at the beginning of this pandemic, a lot of the stay-home orders were really to flatten that curve to protect our healthcare system from becoming overwhelmed. And then the last indicator that we watch is percent of cases with follow-up, case investigation and contact tracing within 24 hours. And the goal for this that was set by OHA and the governor's office is that 95% or more of cases must be connected to contacted. The case investigation has to be begun within 24 hours, and we are at 97%. So now I'm moving from the region to the Washington County. We'll start with the numbers and then we'll look at the indicators. So, and I put in last week's numbers just as a comparison. So you can see that as of yesterday, we've had a total of 1,967 confirmed cases in Washington County. Again, that's a cumulative number since February 28th. 49 presumptive cases. And presumptive cases are people who have been exposed to a confirmed positive case who have symptoms, and maybe they're waiting test results, or even if they have a negative test result, they are defined as presumptive cases. And we treat presumptive cases just like lab confirmed cases. So we do all the same case investigation, contact tracing, isolation, quarantine, follow-up, just like we would a lab confirmed case. So you can see we've had 189 cumulative hospitalizations, 21 deaths. And then the next 4 measures are outbreak measures. So we are monitoring 8 outbreaks within long-term care facilities, 4 within other congregate settings. And then we have 18 just general workplace outbreaks that we're monitoring, and 6 daycare camp type settings that we're monitoring. And just as a reminder, once it's defined as an outbreak, that's 1 to 2 cases. It can be a mix of staff and or in the long-term care facility, it can be a mixture of staff and residents, the same for congregate care settings. In workplace settings, it's people that are employed in the workplace, but it also can be family members that are direct positive cases as a result of exposure to those workplaces. And those, we leave these on and monitor them and work with the organization or the business until 2 weeks after the last new case. So they can stay on defined as an outbreak for several weeks. So here's the OHA indicators specifically for Washington County, and green is good. So you can see that we're meeting 3 of the 5 measures, indicators that we need to meet in order to consider applying for phase 2. But remember, we have to do that as a region. So we have to have, really those regional indicators are important. The 2 that are red are, as I said earlier, really concerning, because we're seeing an increase in the percent of cases that are not linked to existing cases, and we're seeing an increase in hospitalizations. So you might have heard a lot about many of the cases now that we're identifying, and the biggest demographic is 20-year-olds, and that is true. But when we start seeing increasing number in 20, 30, and 40-year-olds, they are, of course, exposing people that are in the older age group and people with high-risk medical conditions. And so we expected to see an uptrend in hospitalizations, and we're hoping that we don't see an increase in deaths related to that. So you probably have heard that there are new state requirements that began really on July 15th, yesterday. And wearing a mask in indoor public spaces has been in effect for several weeks. And it is a, whoops, not sure what that is. Hopefully it doesn't. So wearing a mask in indoor public spaces is a requirement now. And as of yesterday, wearing a mask in outdoor spaces, if you're unable to maintain physical distancing, is a new requirement. And then the governor also imposed no indoor social gatherings of greater than 10 people. So it's really social gatherings. This doesn't apply to restaurants or businesses that may be allowed to have more than 10 people. And I'm sure I'll get lots of questions about that, and happy to answer any of those questions as we move forward. I did get asked the other day by one of our commissioners when we were sharing this information, you know, how do we define public spaces? And I'll give you there are on our website and on the governor's order, there's very specific businesses that were named for indoor public spaces. There was not as clear a definition for outdoor public spaces, but what I can tell you as a public health professional and from a public health perspective, my answer is if it's not your home, it's in the public. And so from a public health perspective, we're really trying to encourage people to wear face coverings anytime they're outside of their home. If they're outdoors and can't maintain physical distancing, to wear a mask as well. There has not been a requirement on all workplaces at this point, but we're really advocating and would ask you all to help support the idea that if you're not in your home and you can't maintain that physical distancing, that we really encourage you to encourage everyone in your businesses and your organizations to wear face coverings. So public health is doing our part. We're doing everything we can to reach phase 2. As you saw, we are doing case investigation and contact tracing within the 24-hour time period. The bulk of our work is supporting folks that are in isolation and quarantine. Isolation is when we ask people to stay at home and to not be around anyone else when they're sick. So they've tested positive and they're sick. Quarantine is basically the same thing. We're asking you to stay home, not to go to work, not to go to the grocery store, not to go anywhere for up to 2 weeks after the last exposure. And that's for people that have been exposed, but they're not sick. We have done a lot of public messaging campaigns. We've done those with our regional partners, with the other counties, with cities. We try to stay aligned completely with Oregon Health Authority. A lot of the focus right now is on physical distancing and wearing the face coverings and staying home when you're sick. Business support, I'm going to go a little bit more into that, but we've provided a lot of support for businesses. We have a call every other week now that well over 100 businesses participate every other week. And then we have a web page that I'll show you here in a second. But we really approach it more from a business support than enforcement. But you'll see on our web page there is opportunities to report concerns about businesses. We have been receiving on average about 62 complaints per week. And we work through that and also work with OSHA or other state organizations. And then the other thing that we spend a lot of our resources and time, and we have large strike teams that we're working on addressing issues in the homeless population, migrant camps, migrant and seasonal workers, everything from ensuring that there's testing, making sure that we provide PPE to those populations. We're working on some increased hoteling for homeless populations. We also have Comfort Inn and Suites, a great partner of ours, who we have been using their hotel as a respite center. So if it's a migrant worker or a homeless person that doesn't have an appropriate setting to isolate or quarantine, we're able to put them in that hotel and support them. So I'm hoping this works. This is we have a pretty robust business workplace support and guidance. So we have information about the business recovery centers, which really are places where you can get information about where you can get PPE, financial opportunities for recovery. And then we have guidance for businesses reopening, face covering. So I'm just kind of scrolling through this, hoping that you're seeing what I'm seeing. But face covering information and a lot more guidance on the actual executive orders. We have the links to the executive orders. You can see on the side links to testing sites, links to what happens during contact tracing, we have each of the different sectors and information about the governor's executive orders for each of those sectors. And then if you scroll down a little bit more, we have public health and disease control information. So we've been getting a lot of calls and questions about what if an employee tests positive. And so you can see there's a toolkit that you can download that really goes through step by step what happens when an employee tests positive, what your interaction will be with public health, how we notify you, what we tell your employees, when people can come back to work. And then at the very end is how do you report a possible violation of the executive order? And so there's a link to OSHA's general complaint form, as well as the county's, what concerned citizens can do. And just so that you are aware, whoops, now let's see if I can get back to, oh yes, I can. So what we do when a violation is reported to us is we contact the business by phone. We have a conversation. 99.5% of the time, we just talk through what the violation or the complaint was. We provide education. Almost every time the business is, oh, I didn't realize that, or I'll work on that, and that's the end of that. We have rarely issued some letters from OHA, and we have not yet had to get to the point. We've always been able to negotiate with the businesses in Washington County. They've been really responsive, and so far we've always been able to negotiate compliance with the executive order so that we don't have to go to the point of issuing violations or fees. So that's been really positive. Like I said, starting this talk is that the support and the responsiveness of Washington County has been really great. So then my last slide is really just a reminder that, you know, I just went through everything that public health is doing to reduce the spread and to help us to move through phase 2. But it really is about individuals and businesses helping protect family, friends, and coworkers by maintaining those physical distancing recommendations, making sure that they're wearing face coverings, really thinking about when they're going out and about, how many people will be there, will I be able to physically distance? Absolutely, please staying home if you're sick, and talking with your healthcare provider about whether you should have testing. But the physical distancing and the face masks are just really critical. Can't say enough about the importance of following those recommendations. And that is what I have for you. And I think then we turn it over to Ken before questions, right?
Actually, I'll take over here and introduce Ken, but Marni, thank you very much. I haven't seen any questions in the Q&A box, but I'm certain that you're not going to get away without several questions. I know I have a few if no one else does. So be thinking about things like exactly how does contact tracing work, and when are we going to see the effects of July 4th and those types of things. So, but with that, I'd like to introduce Dr. Ken Williamson. Ken is a certifiable smart guy. I mean, he really is. He has his doctorate in engineering from Stanford University. He is the director of regulatory affairs for Clean Water Services. But as you can see in your programs that you received, he has a long experience with OHSU and, OSU and other organizations. With that, I would like to turn it over to Dr. Williamson to talk to us about some of the research that's going on and the joint project that you're working on in relationship to wastewater and COVID-19. Thank you for being with us.
Thank you, Pam, for inviting me to come this morning. And I know Mark Jockers was deeply involved in getting me here, so I thank him also. As Pam said, I want to talk to you this morning about a large research program we have going on at Clean Water Services in relating to trying to track the coronavirus in wastewater. Couple of terms here. This whole process is called sewer shed surveillance. Sewer shed surveillance has been around for a long time. People have used it for other diseases. It had its primary initiation in following polio viruses in wastewater. And then it came back into favor now. People are trying to see if they can actually track positive cases of related to this virus through concentration in wastewater. Now that's physically possible because as your body reacts to the virus infection by actually killing the cells that are infected by the virus, your lymphatic system that expels those cells from your body, and many of those cells are expelled in your feces. And so if we look for the RNA signal of the virus in feces, you actually find it, and I'll show you some slides here. So if you look in cases in Oregon, the cases, Marni talked about this, we have had this uptick now in June. And have moved from somewhere around 50 to somewhere around 200. You know, I want to give kudos to the whole healthcare community and all of the efforts that they have in trying to deal with these cases. They have an elaborate system that works in a very positive way to control outbreaks and epidemics like this. Obviously, the uptick is associated with the reopening that occurred back in May. And now we're trying to introduce new efforts to put that control in place. One of the things that one sees is you need all the tools that you possibly can. And so what I want to suggest is that the sewer surveillance is just one more tool in our tool chest of being able to deal with epidemics like this. Certainly, we hope that someday it can help healthcare professionals. And I'll give you some examples of our efforts and ways that we're cooperating with the healthcare community. In Washington County, these are the zip codes in Washington County. We plot up this date every week just to see what the cases are doing. That top line there is Hillsborough. The top line there is Hillsborough, and the dark blue line is Forest Grove. Two of the largest zip codes, and that's the reason why the numbers are larger. But you can see again, sometime in June, there is an inflection point. The curve gets steeper as the number of cases started going up, and this was probably largely associated with the opening up of the economy. We're interested in these zip codes because we're trying to find isolated areas within Washington County that may have higher cases than other areas. And so this is what we call micro sewer sheds. That is that we're looking for isolated areas that we can isolate the wastewater flow, sample it, and actually see what the concentrations are. So how did Clean Water Services get involved in this? Well, one day I got a call from my CEO, Diane Taniguchi. Often crazy ideas come from Diane. It's not unusual. And she said, this was shortly after the outbreak in Washington County, is, can we measure this virus in our wastewater? And I said, well, that's an interesting question, Diane. I'll look into it. And what was interesting is that afternoon, I was reading some scientific literature, and the paper came out where they had actually determined the RNA sequence for this virus in China and published it. And so with that, I said, well, yeah, we probably can measure it. If we know what the RNA sequence is, we can search for sections of that RNA that are specific for the virus. And so I wrote an email to my colleagues at Oregon State University that I used to work with when I was school head there in the College of Engineering, and said, would you guys be interested? Because, you know, we have wastewater, we can sample it. And I knew that these people worked with genetic signals and molecular methods. And so it sort of sat around for a while, and then I got a call back from them and said, well, yeah, we're sort of interested. Let's do something. And so we got together and we wrote a proposal to the National Science Foundation around this whole micro sewer shed concept. And again, this is a research project, and I always want to remind people that this is a research project. We're trying to show that this would be possible. It would be possible to do this, that it can be successful, that the tools are available, and that we can generate the appropriate data. So in sewer surveillance, the idea is to measure compounds or microorganisms in wastewater. People have done this for drugs, both legal and illegal drugs. They've all followed various microorganisms. And the idea is if you could find it in wastewater and follow it up the sewer, you could associate it with a particular source. Now, at Clean Water Services, we had a lot of expertise in this because this is what we do with many of industrial discharges. So if we get an industrial discharge that upsets one of our wastewater treatment plants, we then start going back up the sewer trying to find where that material came from. So we had the techniques and we knew how to do this. And from the sewer surveillance, you can get both a temporal and a spatial signature. That is that you can know when it happened exactly because you can follow it in time. And then you can follow it to where it's actually coming from inside from the infrastructure. These are typically composite samples. There's a whole variety of samplers that one can use. But these samplers then are programmed to take samples. You can program them down so they'll take a little sample every 10 minutes or up to an hour. And then they sample across the whole 24-hour period. You can also program them so that they'll sample in relation to how much flow is coming past the probe. So you can get flow average composite samples too. And the idea here is that this is potentially lower cost. We can sample an entire city for COVID, for the SARS-CoV-2 virus in the influent to a treatment plant for about $100 a day. If you look at Marni sampling human beings, to sample one human being with a swab sample is about $100. So we got this huge scale of being able to know when the virus is there. Now, with sewer surveillance, you can't tell who has the virus. We can never know who has it. All we can know is that somebody else has it out there and it's been added to the wastewater system. So potentially lower cost. The other one is that when people get infected with the virus, you can pick it up in the wastewater immediately. And so we talk about this thing being a leading indicator. And if you look at cases where people follow the virus by hospital admissions, you're looking at after infection, probably before somebody shows up at a hospital. At best, it'll be like 4 weeks. At worst, it'll be 6 to 8 weeks before they show up at a hospital. So those numbers are a little harder to actually follow a virus. So we hope that this can be a leading indicator. So if you look at the virus, the genetic components of the virus are inside. They're protected by this envelope. And so what we're looking at is a very small section of this RNA. That's what we're looking for that tells us that there was a virus particle there. And the CDC gives guidelines about what section of the RNA you're looking for. We're looking for what's called the N1 and N2 signal, which is the RNA that provides some of the protein for this envelope surface for the virus. Okay, so there's two proteins in this virus. One comes from N1, one comes from N2. And so that's what we're looking for. Now, in the feces, there is no indication that this viral material is infectious. Whatever happens in your gut, this is deadly to the virus. And so when we're looking at our samples, what we're looking at is these RNA fragments. And that gives us the correlation to the number of viruses that were present at one time. But we're not actually measuring the virus. What we're doing is measuring this RNA stuff that is spilled out in the material. So if you look at sewer surveillance, there's sort of three important signals that you can get from it. The first, and the one that's been used before, is community prevalence. That is that you can know whether the virus is present or not. So if we pick up the virus in the wastewater, you know that you have people with an active infection who are discharging fecal material to that wastewater. And from those prevalence numbers that you get, you can actually compare communities. So you can know whether your community is better than somebody else's just by the numbers, because they're all sort of relative. And we measure concentrations. The detection level in wastewater for the SARS-CoV-2 virus is about 5,000 viruses per liter. And so that's about the lowest number that we can detect. We have detected numbers in our wastewater much higher than that, in the almost to 1 million viruses per liter. So you get very high levels when you have a high number of infected individuals. I just saw some numbers yesterday. They're now measuring numbers in Southern California, where they have hundreds of thousands of people that are infected in the wastewater plant, on the order of 6 to 8 million virus counts per liter in the wastewater in LA County. The other thing you can do is you can look at trends. That is, you can look and see whether your numbers are getting bigger or smaller. Marni talked about some of their numbers, and they're looking at trends. And so over time, you can take the data from wastewater plants. We sample now once a week, and you can see whether it's the numbers are getting bigger or the numbers are getting smaller. And actually in Washington County right now, for our numbers, the numbers are actually getting smaller. So you can look also at changes in trends. So these are some of the things that we are searching for in sewer surveillance. So here's some numbers, initial numbers that were taken in a study, a national study we did by a company called BioBot Analytics. We would send off samples to them, and they would run the viral concentrations in our 4 treatment plants. We did this study because one of the things that I wanted to know is, can we measure this in our wastewater before we got deeply involved in this thing? Because I didn't want to start a study and then find out that there really wasn't anything happening here. And so a couple of the things that we learned out of this data is that it's pretty spiky. It changes from week to week. It's not some sort of a flat curve that's always the same. It goes up, it goes down. And one would expect that because basically these are coming up from infected people. A single infected person puts a lot of viruses into the system. So a lot of it depends on the number of people and how fast people are getting well. The other thing was that we observed very large numbers in April. And so there were several outbreaks in Washington County. Marni talked about a series of those outbreaks. And you can see these peaks that sort of go off the curve here. These were associated with outbreaks that had happened in Washington County on the orders of 5 to 10 people. So you can see the level of viruses that come into these systems from a single outbreak. So from this, we decided that we wanted to move ahead, and I'll show you a little bit more data of sort of where we would like to go. This is data from New Haven, Connecticut, and data that they collected about the viral RNA per milliliter that was in their wastewater treatment plant associated with hospital admissions. And so the 2 lines here, the blue one is the virus, and no, the red one is the virus, and the blue one is the RNA. The red one is the virus, and the blue one is the hospital admissions. And you can see the close correlation that occurred here. And by taking this kind of data, and here they associated with new COVID cases, they were able to get the correlation coefficient between how many new virus that you associated in the wastewater with the number of new cases. And it came out to about for every new case, you ended up with another 1,000 RNA copies per mil in your wastewater. And from this, you can actually make an estimate from these measurements of how many new cases that you have in your sewer shed. And these are the kind of data that we're seeking to find in Washington County. And so, again, we wrote this study to the National Science Foundation with my colleagues in the Chemical, Biological, Environmental Engineering department at Oregon State University. And we had 2 objectives. One of them was to look at that BioBot data and try to understand why is it so spiky and how does it compare to various sampling and analysis techniques. And then the other one was that we were trying to look at this idea of micro sewer sheds. Could we go into all of the sewer sheds, of which there's 4 major ones in Washington County, and find small areas that we could sample, that we could associate then the positive cases in that small area with the concentration in the wastewater. So this project was funded at the end of April. So if you think about that, we've been working on this project May, June, and a little bit of July. And I can tell you that that is absolutely lightning speed for a research project, especially a research project associated with a university. And so we have really been scrambling, trying to push this project forward and overcoming all the many obstacles we ran into. Again, I want to say that this is a research project. We're really trying to show that this will work, okay? We're not a consulting firm that provides surveillance for people and gives them data that they hope is very useful. We're doing research. But I will show you some of the things that we have been successful at. Okay, let's go. So in our targeted sewer shed, okay, let's go back. Can we go back? Let's see. We can go back. Okay. No, we're going forward. There we go. There we go. Okay. One more time. One more. There we go. So within Washington County, we picked 23 different sites. And some of these are very small and much of them are bigger. We looked at mixed land uses, business types, and community facilities. We're sampling hospitals, food industries. We're sampling the Washington County Jail. We're doing nursing homes, community, resident retirement communities. We're looking at both low-income communities and more wealthy communities. And what we want to do is sample once a week for the next year to see what these concentrations are and how they are influenced by the number of people in it. And what have we learned so far? Well, we got 6 weeks of sampling. Some of that has been analyzed, some of it hasn't. All the samples can be frozen until they actually get analyzed. Our highest levels that we found are associated with our food processing industries where there were known outbreaks. Nothing surprising about that, but we picked that up in the sewers. Our next highest is downtown Hillsboro, which includes the Tuolity Hospital and also a low-income neighborhood. Unfortunately, we don't have manholes that we can separate out those two different flows. And then our next highest levels come in the Forest Grove low-income neighborhoods. And we have a couple of neighborhoods in Forest Grove that we find reasonably high concentrations in. So I want to talk about some of the other efforts that we've been involved in. We've partnered with what's called the TRACE group at Oregon State University. These are three colleges that are bound together, and what they do is they do public health testing in cities. So they'll come in for a weekend and do swab testing at about 600 homes. So what they do is actually knock on the door, people respond, they ask them, are you willing to be tested? They then take the information that people decide whether they're potentially symptomatic or asymptomatic, and they do the swab test. And they do this with great statistical precision, so they're able to generate a number that describes the total positive cases in that system. And so what we're doing is when they go into cities and do this, we do the sewer surveillance at the same time. So we go in and for the week before, we take samples at the wastewater treatment plant. And during the 2 days that they're testing, we actually go out and test a number of different manholes and pump stations throughout the sewer system. Presently, this has been done at Corvallis, Bend, and in Newport. And Corvallis and Bend, there were very few cases, but in Newport, we sampled after the outbreak. There was a large outbreak in Newport associated with the fish processing facility. They had about 170 cases there the week before we actually showed up. Move forward. Go forward. Yes, no. There we go. So this is the map of Newport, and what you see is each one of these tags here are one of the sewer sheds that we actually looked at within come on. And so we looked at 26 different we looked at 26 different micro sewer sheds in Newport. And at the same time, the TRACE group determine the positive cases in each one of those sewer sheds. And so the data set we presently have is we have the number of positive asymptomatic and symptomatic cases in each one of those 26 areas. We have the number of positive symptomatic cases reported by Lincoln County in each one of those areas. And then we also have the virus RNA copies per liter of wastewater in each one of those areas. And this is a fantastic data set. There's nobody else in the world that has a data set like this that shows the correlation between these three types of data for particular small areas. The Newport case was interesting. Trace determined ultimately that about 3.4% of the population was actually positive in Newport, which means that there's about 11,000 people who live in Newport. So that means there was about, the day we tested, there was about 400 positive cases actually in Newport that we have data on. So that project was also associated as we were looking at two small communities on the Oregon coast, Yachats and Depot Bay, trying to understand what the impact is of non-resident populations as far as bringing COVID-19 into the community. And if you look at what happened in New York, the outbreak in New York didn't occur because of the resident population, but it was the European population that flew into New York that brought the pandemic there. And so we wanted to look at this on a micro scale and trying to do this on the Oregon coast. If you look at both these communities, they're overwhelmed by tourists in the summer. And so we started sampling in Yachats and Depot Bay. And now this has been expanded because Lincoln County has asked to sample all 7 of the treatment plants on the Oregon coast to see if the virus has been spread from Newport to these smaller communities that are within about 50 miles of Newport. Okay. Your interconnection is unstable. Okay, that's good. Move the numbers. Okay. Oh, that's not.
Ken, are you just about wrapping up?
Yep, I'm just about done.
Okay, great.
One more slide.
Okay, thank you.
And so, let's see. Lastly, we're working with Oregon Health Sciences University, and we want to take this system to Portland and work with the Bureau of Environmental Services. And they want to potentially sample some small minority communities in Portland. So with that, I am done. Thank you, Pam.
Well, I certainly didn't mean to rush you. I was maybe trying to do a little tap dancing while you were figuring out what was going on with your slides. Thank you so much for your presentation. It's fascinating to see the work that's being done, and little did I know that one of our breakfast forums would be focused on this aspect of wastewater. So I really, really do appreciate it. And I guess thank you to you and your partners for your creative approach to looking at all aspects of this pandemic and how we can circle the wagon, so to speak, and make sure that we're all working toward an end goal of reducing the impact of this pandemic. So we have quite a few questions in the chat. I have some as well. We have questions in the chat, and we also have questions in the Q&A. But Marni, what I'd like to start with you. And there's been a series of questions about reporting and the issue of wearing a mask and how do you behave in the situation where you're in a commercial environment, whether it's a bank, whether it's a grocery store, wherever, and you're feeling unsafe because somebody there isn't wearing a mask? What are the steps that you take in relationship to reporting that instance or following through?
Sure. That's been one of the really difficult questions that has been asked of really the governor and the governor's office is, you know, can your executive order be enforced around mask wearing? And the answer is, and I'm the messenger, it's the governor's office executive order, but the answer is that technically it can be enforced. I saw one of the questions is, can you call law enforcement? And we really don't recommend calling local law enforcement. It's not going to be a priority for them, and they have a lot of really important work to do. What we recommend is really just doing what you can to ask patrons or visitors to your organization to wear a mask. If you're able to offer disposable face coverings to people, if you're able to offer that. We also understand that it's really difficult to ask your employees or you know, other people to try to enforce wearing a mask. If it's a consistent problem in a particular business, I've posted in the chat, I think, how you know, where the link to reporting. We're happy to work with businesses and our community-based organizations to kind of strategize, but it is a tough one. There isn't any perfect answer. I think it's, you know, the governor's answer is really just trying to cajole and plead and ask people, but some private sector industries, especially if you have membership, you can absolutely refuse and deny memberships because it's a private entity and you can set your own rules. But it really is, we're really asking and dependent on businesses to enforce the executive order for the governor's office. We're just here to provide support.
Thank you, Marni. Ken, there's an interesting question. All the questions are interesting, but there's a question from Carl Sonnenberg. He says, I'm impressed with sewer analysis and seems like individual fecal tests would be more accurate than nasal swabs, which has a 20 to 30% false negative. He says a fecal approach is sort of like testing pets for illnesses or humans for bowel cancer. Has public health considered this sort of individual COVID test? So this is a question that is for Ken and Marni.
Well, we've actually talked about that, and you know, I don't have an answer, but it would be an effective test. So you know, it would be a very strong indicator. I think there's just a little more futzing around with actually dealing with fecal material. Anybody who's done these bowel tests for blood in the stool or whatever realizes, you know, that there's just a lot more steps involved, and then you got to send it in the lab or whatever. But is it possible? I think it's possible. Marni probably knows a lot more. I'm not a healthcare professional.
Yeah, I don't have a lot to add. I think that it is possible. I understand that you know, that there is some evaluation of some fecal tests. The other thing is acceptability to the patients, and it might seem funny, but they're generally more apt to allow you to swab their nose than to collect a fecal. Even some tests are, you know, home tests. Like now your cancer screening can be done at home, but people just don't want to mess with their feces, and it's hard to get them to do it for cancer screening. So I think some of it is acceptability, but I think it's a viable option that I think that the health systems are looking at, health community is looking at.
Marni, I'd asked you a couple questions before we broke, and I'd like to follow up with when do we see the effects of the most recent holiday, July 4th? When might we see?
Yeah, so I think that we might start seeing the effects of that now and into the next week. So I'm really hopeful. There was a lot of messaging over right before and over the 4th of July holiday. So I'm hopeful that people listened and really wore their face covering and didn't go to large social gatherings, but we won't know that for at least another week or 10 days.
Thank you. Val Valfrey asked the question. First of all, he says, Marni, thank you for your excellent work. How many contact tracers do we have in Washington County? What is your goal? And are they experiencing challenges in receiving cooperation?
That's a great question. So you may remember that one of the gates to entering phase 1 from the governor's office was that Washington County needed 92 case contract tracers, and we opened with fewer than that. But I refer to them as surge staff because it's really, we need nurses to help with the case investigation and outbreak strike teams. We have community health workers and to help with the contact tracing, which is actually a follow-up call to ask where you've been, who you may have come in contact with, and we do that multiple times using specific motivational interviewing techniques. And then we also have epidemiologists and we have support workers that are supporting people in isolation and quarantine, making sure people have food, making sure that people have access to any clinical or medical treatment that they need, connecting people with the health system as needed, and social services as needed. But in total, we now have over 140 what I'm calling surge capacity staff, which is that large team. So, and what I would remind folks of is public health. In January, our total public health workforce, including all our environmental public health, our maternal child home visiting, our WIC team, and our disease prevention team, the total public health team was just around 100 people at that time. And now we have, just for this COVID surge work, 127.
Thank you.
Yeah.
Ken, can you answer this question about what are the exposure concerns to the people that work at Clean Water Services in relationship to the work that they're doing with testing the sewer water?
There's been no known cases of people getting infected with COVID-19 from fecal material. Okay, so that's just the clinical part of it, and for that reason, there really is not much of a threat to people who are dealing with wastewater. Now, given all that, we still follow the OSHA guidelines for contaminated aerosols. So all of our people who are exposed to any sort of wastewater aerosols wear masks and wear face shields, and then gloves and protective equipment. So we use that for all of our employees. But there's been lots of work done on whether this material is infectious from feces, and there's been no reported cases so far of that occurring.
Thank you. This question is for Marni. It's from Tom Holt. Can you tell us a bit more about what Washington County Public Health does with information about a person discovered to have COVID-19? Is this information shared with local health systems for them to take appropriate follow-up care steps, what lessons learned so far, opportunities, do you see around the handoffs from public health to the rest of the health system?
Sure, thank you. That's a great question. So I'll start a little bit with what happens. So typically, when somebody has symptoms of COVID or they're concerned that they may have been exposed, they usually start with their health system. It might be a drive-through testing site or a Walgreens testing site. But the healthcare systems, the doctors, the laboratories actually have requirements to report the positive test to public health within 24 hours. So the health systems report the test to us, which is similar to other communicable or infectious diseases like tuberculosis. So then once we get that report, we do a case investigation. So we call the person and we do a thorough interview that includes everything from what types of symptoms they have, what kind of access to healthcare do they have a doctor, do they have symptoms they're concerned about, are their symptoms getting worse? So we do that kind of a screening all the way to where might they have been exposed and who might they have exposed, so where have they been? We also do an assessment of their ability to meet their basic needs. So do they have a way to get food? Do they have income? So we do that kind of an assessment. And then if we need to, we will connect them to a healthcare provider, or if we need to help them find a safe place to comply with, say, isolation orders, we'll make sure that we can provide them either get them set up at the respite center. If they need food delivered, then we have an isolation support team that does that. So we have really strong relationships with the healthcare systems, including our federally qualified health centers, Neighborhood Health Center, and Virginia Garcia. They have been fabulous partners. So for example, Virginia Garcia goes out every week to some of our large migrant and seasonal farm camps. And they not only provide testing, but they also provide follow-up primary care services. So we definitely, that's one of our roles, is to ensure that people have access to those health services. And if we also are working together to ensure that we can support one another if there's surge needs or emergency needs, to make sure that there's plans in place for a surge hospital if that's needed, and that we're working regionally and that we're working together.
Thank you. Thank you very much, Marni. We have a question from Carol Greenow, and that is, this is directed to you, Ken. Is it possible that the wastewater testing be used predictively, for instance, to identify when a school should close down before there is a surge of the disease?
Well, that's an interesting question, and that's one of the reasons why we're trying to do particular facilities. For example, we sample from a nursing home in Beaverton. It has 360 beds. Trying to see whether that's possible to sample an institution and use this as a predictive method. I'm actually right now working with OHSU, and we're writing a proposal to maybe look at schools. So to actually have, sort of routine sampling of schools on maybe even every day or every 2 days or something, to get the data back much sooner. To do that would take some modification of sampling techniques. These small flows are very difficult to sample, but it could be done. And we're particularly interested in schools that have a high minority population. So that's going to be a serious issue in the fall. And I think this might be a technique that we could look at schools to actually provide a leading indicator of whether there is a significant outbreak inside.
Thank you, Ken. Marni, would you comment, please, on the demographics of this disease, especially in our region? I know that what our demographics look like from the standpoint of cultural demographics, and I know that we have a higher percentage of this disease in our disadvantaged communities. Can you comment on that for us?
Sure. And I also want to say that, I think from a public health perspective, that's we're really interested in Ken's work and whether it can be used in the future for predictive, we call it sentinel surveillance in public health. So we're really interested in that. But what we expected and what we have found is that COVID-19 does disproportionately impact our BIPOC or our communities of color, Black, Indigenous, people of color. In Washington County in particular, over 52% of our cases have been in the Latinx community. And it is not, there's not something genetically different about Latinx people. I also really like to point out, it is not because of their behavior or their choices. This is, what we're seeing is that they are at higher risk because they're in essential roles. So they during when a lot of us were able to stay home and work from home or telecommute, they were not able to because they were in nursing homes taking care of our elderly parents, or they were in the agricultural world of either, farming and making sure that our food hits the table, manufacturing, packaging, transportation. So they are in essential roles and they've been getting exposed and then taking it home to their families. So I think that's really important to understand, because I hear a lot of comments about, that it's cultural decisions or behavior, and it's not. They were working in essential roles in healthcare, food production, and manufacturing.
Thank you for those comments, Marni. I really appreciate that. Annie Herbert has a question for Dr. Williamson. Has the sewer shed study garnered interest from other U.S. counties and the federal government to date? When will the final research study results be published?
There's a tremendous interest in this across the United States, and I don't know of any state that somebody isn't doing something associated with measuring COVID-19 in wastewater. There's been some large efforts. There's going to be a large effort here. We're going to get funded by OHSU to sample 41 sewage treatment plants in the state of Oregon over the next 3 years as a way of potentially picking up outbreaks in communities. They're especially interested in the smaller communities throughout Oregon. The state of Utah has done a similar thing. They now require COVID-19 testing, SARS-CoV-2 testing of wastewaters throughout the state of Utah. So this thing is sort of going everywhere. Everybody's trying to figure out how to do it, how to get the samples run. One of the big challenges is trying to get the samples run faster. And so this thing happens so fast that you really want the data back as soon as you can. Been a tremendous backlog on samples. For us, when we first got started, the biggest barrier was that the university labs were shut down. So we had a university project, but we couldn't run it in the labs. And that's one of the reasons why Clean Water Services is involved, is we set up operation in our laboratory because we're open. We were essential workers and we had to be open. There's still those kind of problems. And there's all sorts of supply chain problems of actually getting the samples done. So yes, there's tremendous interest. Lots of people are working on this. And my expectation going forward is that we're going to be doing samples nationwide at wastewater treatment plants far into the future. That's what I see. But this is going to be proved to be successful enough and cheap enough that people are just going to see it as an important thing to do.
Thank you. Last question for you, Marni. Face shields or masks?
I get that question quite a bit, and I think what's important is that you're covering your nose and mouth. And it depends on the situation. Obviously, healthcare workers have very specific needs, and they wear medical masks, N95 masks. But for the general public, if it's a shield, which is the plastic covering that kind of wraps around your face, as long as it covers your mouth and nose, and what I've seen is people wearing it so it's really tilted up. And so your nose and mouth are exposed, and that's not helping. Or cloth face coverings or disposable face coverings. They really have been found to be effective. And I think, you know, it's important to remember that when I wear a mask, I'm protecting you. And when you wear a mask, you're protecting me. And it's higher than 50% of our cases in Washington County have been asymptomatic. And so that asymptomatic spread is still really common. And so it is extremely important and is extremely effective to wear face shields. And there's a question about bandanas. Anything that is covering your face, your nose and mouth, is going to block the larger droplets, and so anything is better than nothing. So yes, a bandana is as effective as other cotton cloth face coverings.
Great. Well, we just had one last questions about bandanas are of little, if any, use. Same for a turtleneck shirt pulled up, but I think you answered that question. I just want to thank both of you for the time and the amount of information that you've shared with all of us. That it's been very beneficial, and I really do appreciate your participation this morning. So thank you, Dr. Williamson. Thank you, Ms. Kuyl, Marni. I really appreciate your information, and we'll be contacting you in the future to ask if there's follow-up as well. So with that, I would like to go to a slide that shows us what the upcoming events are going to be. Again, thank you to our Forum Series sponsor, Legacy Health, and thank you to Metro West for sponsoring this event. This slide tells you what's coming up for us in the next month. This is a reminder to you that we are still, as a staff, we are on furlough. We're working 60% at this point to make sure that we can continue the viability of Westside Economic Alliance. I want to give a special shout out to Casey Reinhardt and to Teresa Dunham for the amazing amount of work that they've been able to do for the organization during this time. So, like I said, special shout out to them. This tells you what's coming up. I also want you to know that I am working with the school superintendents in this area to see if we can put together a virtual forum with school superintendents to give us a perspective on what does the school situation look like for the fall. With that, I'd like to thank all of our participants. Thank you for calling in. I know I missed one person with a raised hand. I apologize to Aaron Adams for that. If you have a question that you would like us to pass on to Marni or Ken, please let us know. You'll also receive a survey within the next day that will ask you about this event and what your thoughts are about future events. So thank you. Have a wonderful day. Enjoy this beautiful weather that we're having. Again, thank you to Ken and Marni.
Thank you.
Bye-bye.
Bye.